Hello, I'm Dr. Sundari Mace, Sonoma County's health officer. I'm here to share the latest update on coronavirus in Sonoma County with you. As of today, May 13th, we have 333 confirmed cases, up 21 in the last 24 hours. Of these, 161 are active, 168 have recovered, and we have 4 deaths as we have reported. We've now performed 10,682 tests. Today, I'd like to talk a bit about the new data that we have up on the dashboard, socoemergency.org. We want to talk about the impact of COVID-19 on people of different race and ethnicity. We found from our race and ethnicity data that there are some disparities between groups. We are tracking this data for COVID-19 positive cases in the county. Consistent with national and state data, currently, people who identify as Latinx, Latina, Latino, or Hispanic represent nearly 60% of COVID-19 positive cases in Sonoma County. That means that this virus is disproportionately affecting people in this group because Latinx households make up 27% of the county's population. Currently, most COVID-19 cases in Sonoma County are identified through contact tracing, as we've discussed before. More than half of Sonoma County's COVID-19 positive cases in all race categories are determined by tracing them from a close, often household contact of a person who tested positive. And we are doing this proactively, as we've discussed before. This is early data, and testing is expanding, as we have noted, so we might get a more accurate demographic profile of the impacts of COVID-19 in Sonoma County as we continue testing. It's not only important to monitor the disproportionate effects of disease on populations and groups, but we have to take bold steps to immediately intervene to reduce the spread of COVID-19 in the Latinx community. We know that where we live, learn, work, and play affects our health. Health differences and disparities between racial and ethnic groups are rooted in unequal economic and social conditions and need to be addressed. So what are we doing to address the situation? We are taking the following action to reduce the spread of COVID-19 among the Latinx community. We're scheduling outreach events that include testing for COVID-19, education, and support materials. Plans have begun for events in Petaluma, Santa Rosa, Healdsburg, and Sonoma occurring in May and June. We're using our partnerships with community organizations, key stakeholders, community groups to address the need for coordinated efforts in communication. Currently, the county coordinates and facilitates a large work group of Latinx leaders and service providers that meet frequently related to the coronavirus response. We also use these partnerships to communicate mitigation strategies, share trends in COVID-19 cases, identify risks, and develop new strategies to address these risks. All communications, including materials and information on the SoCo Emergency website, on social media, are translated into Spanish. The Sonoma County Warm Line, which has recently been established to respond for any mental health needs surrounding this emergency, does include bilingual Spanish counselors. A specific communication plan for the Latinx community was drafted early in the disaster. It includes targeted paid advertising to the Latinx community, including regular ads on Spanish radio. Communication with other sectors like transportation, childcare, and agriculture about potential increased risk for Latinx community members to ensure proper mitigation strategies are in place. The production of health-related short videos in both English and Spanish, featuring local native speakers that are healthcare clinicians who serve as trusted resources to the community, is also under progress. So these are long-standing injustices that have led to these outcomes that we're seeing. And at this point, we have an opportunity to take concerted steps to overcome inequities, transform our thinking and actions for the stronger for all Sonoma County. Now I would like to go ahead and talk about the parks order. So I'm really happy to say that I've amended the parks closure order, or even the soft opening, to allow residents to drive to nearby inland parks and provide more options for basic outdoor exercise during the stay-at-home health order. This amendment allows for park managers to open tennis courts, golf courses, boat launches, and other recreation facilities. However, use of these facilities is restricted to single individuals or members of the same household. Again, to really reduce person-to-person contact that could be a risk towards transmitting COVID-19. While we're still encouraging people to stay home or close to home, relaxing the park's order gives access to a greater number of Sonoma County residents. If you drive to a park and see there's a lot of visitors there, please come home and visit another time. Coastal parks do remain closed to visitors who drive to the coast. However, for coastal residents, the parks are open for walk-in and bike-in access during certain hours. These hours are from 11 a.m. to 5 p.m. daily. These restrictions are in place because beach parks are popular destinations that draw visitors from all around Northern California. Limited access is intended to reduce the likelihood of unsafe crowding during the shelter-in-place period. So we do have a community question. How are we going to get out of the shelter-in-place order if we keep testing and finding more cases? Well, as a community, we need to test about 750 people per day in order to move to the next stage. If we don't test, we won't know how broadly the virus is spreading. We won't be able to open without that knowledge because it puts too many people at risk. About 1/3 of people who test positive are asymptomatic, have no symptoms that is, that can still spread the disease. So if you're able to, please do go and get tested. Every test that's completed brings us one step closer to a safe reopening. To schedule a free test from Optum Serve, you can go to lhi.care/COVID testing or call 1-888-634-1123. And you can schedule a test in either the Santa Rosa or Petaluma locations. And for the priority groups of essential workers, symptomatic people over 65, symptomatic people of any age with underlying health conditions, any healthcare workers and emergency responders, you can make an appointment through by calling 707-565-4667 to schedule a COVID test through our own county's drive-through testing site. Remember, let's be patient and kind to one another and offer help and support instead of anger and blame. We're getting through this together and we're protecting our community's health together. So thanks for joining. Stay healthy and safe, and we'll talk again on Friday.